Hi, my name's Mackenzie Kelsey. My presentation, or my population I decided to work with this semester is sexual assault survivors. So in describing the population, I started with the definition of sexual assault. And it is defined as illegal sexual contact that usually involves force upon a person without consent or is inflicted on a person who is incapable of giving consent. So, looking at the population, sexual assault can happen to literally anyone and has been happening since the beginning of time. So with the no boundaries thing, there's no age, sex, gender, religious preferences, sexual orientation, or socioeconomic status that can protect you from sexual assault. It honestly can reach every population that there is. The only thing is there are certain genders or sexes like females and people of lower socioeconomic status and people of the LGBTQ community that are at higher risk for sexual assault. Recently, within the last 40 years, the stigma behind sexual assault has been challenged. Women's rights, along with real prosecution of sexual crimes, has been brought to the forefront, and we still obviously have a long way to go in changing some of the stigma around sexual assault and making it more of an issue and dealing with it appropriately. Some of the reasons or health disparities that I thought would fit this population is lack of social support, access to healthcare services, and current social norms and attitudes. So, with going with the size of the population, I was unable to find any local statistics, but statewide in 2018 there was 1,753 reported rapes in Utah according to the FBI, which is about 55 per 100,000 people, whereas nationally there were 139,380 reported rapes and about 42.6 per 100,000 people. So that ranks Utah at about 11 in the nation for rapes and sexual assault. Internationally, I was unable to find any reliable statistics. There were some statistics, but there were not a lot of references for those. A lot of it was that they don't count or record rape or sexual assault, and especially true in third world countries. There is quite a difference in state versus national statistics for Utah, and some of the ideas I was kind of throwing around were possibly the sexual repression due to the predominant religion of the LDS community in the area, and also that same religious beliefs could also reflect in the attitudes and social norms of the area. And then the rate of pornographic material in the state is also high and could possibly reflect some unhealthy sexual problems in the area as well. Contributing factors and social determinants of health. So the social determinants of health that could present a barrier for this population could be access to educational, economic, and job opportunities. So people suffering from sexual assault often aren't able to leave their homes, feel unsafe, and have a hard time connecting with people, so it can make access to educational and economic and job opportunities difficult. Also, access to healthcare services. There's a lot of stigma and interesting attitudes sometimes and judgment. I feel like we've done a really good job within healthcare, especially now, to not have those stigmas against people and be an advocate, especially in the nursing world. But I think there is still some access to healthcare services that could present a barrier for this population, especially when it comes to mental health services. Culture and social norms and attitudes. So, in society, condoning violence, using power over others, the traditional constructs of masculinity, as in men having power over women, subjugation of women, and staying silent about violence and abuse. I feel like, especially with the Me Too movement recently, we've kind of broken some barriers about staying silent about violence and abuse, and I think that is a healthy way that we are trying to break through some of those things. So contributing factors and specific concerns. So a big concern for this population is psychosocial. These include things like PTSD, anxiety, and depression. Those are very common with sexual assault. And then the other is the actual physical trauma, like wounds, infections, and lifelong impacts, sometimes including fertility or pregnancy, that can come along with being sexually assaulted, that are contributing factors for the social determinants of health. So when we talk about the root causes, it kind of goes back to what we were just talking about, the mental and emotional trauma that have been taken on by these sexual assault victims, and then the physical trauma that they've also endured are kind of the causes of these social determinants of health and health disparity. So going through Maslow's hierarchy of needs, within the population of sexual assault survivors being extremely broad, the severity of the assault, the specific person's reaction to the trauma, the support that they have are all going to determine whether Maslow's needs will be met. So this one's kind of a hard one to answer for this population. So I kind of just went with unmet for everything. So with the physiological needs, there are several things that can go unmet with sexual assault, including food because you don't feel like eating. Sex obviously can be difficult and probably not even capable of thinking about something like that at that point after a trauma. And then sleep disruption because of, feeling unsafe and just having nightmares from trauma and not being able to sleep. The safety level is probably the most common unmet need for this population. The assault of the person disrupts the feeling of safety and security, and these feelings and emotional trauma can also affect the ability to go to work or school and keep meaningful relationships, and has negative implications on the rest of the pyramid of needs. So, like we learned in nursing school with the Maslow hierarchy of needs, if the first level is unmet, then we can't it's not possible to meet any of the needs of the other parts of the pyramid. So the variable functionality level, when we think about the anticipated functional level, it's going to be variable. Most will remain at the physiological level at first because of the physical trauma that comes along with sexual assault. And then, especially when we talk about the safety level, that definitely would not be met for most. And it all depends on the treatment and the counseling available to the survivor and to what level they will be able to acquire over time through treatment. The likely health outcomes. So the health outcomes for this population vary greatly. Several factors will affect how the sexual assault survivor will achieve. Most people in this population will suffer from lifelong effects such as anxiety and depression, and while some learn to cope and deal with them through counseling, others, especially in poverty or low socioeconomic status, may not recover as cope as well due to the lack of medical care and resources available to them, leading to poor health outcomes. Specific concerns. So with this, the communicable diseases or infections, this is a big one for sexual assault survivors. So especially right after being assaulted, we're at risk for syphilis, gonorrhea, chlamydia, herpes, and other sexually transmitted infections or diseases. And then some of the ones that can have more long-term effects, HIV and AIDS, hepatitis, pelvic inflammatory disease. Some of these can cause infertility and problems getting pregnant if you were to try to get pregnant in the future. So things to definitely think about. And then non-communicable diseases or infections. One that I thought fit this category was pregnancy. So according to RAIN in 2020, there's a 3.1 to 5% chance of getting pregnant from unprotected intercourse one time. And obviously there are a lot of dependent factors on how old you are, your fertility, your medical care after the assault, if you receive medical care or you don't receive medical care. I know I'm taking a forensic nursing course right now, and we're talking about being a sane nurse and helping with some of those things after an assault, in giving them birth control and testing them for STDs and prophylactically giving them antibiotics for a possible STD infection, and just making sure that we've covered all the physical bases, especially with pregnancy for that. Specific concerns for self-care and self-harm. So, suicide, anxiety, depression, PTSD, drug and alcohol abuse. These are all going to be self-care and self-harm related to sexual assault survivors. I think some of the statistics I was reading, that they're 10 times more likely to use hard drugs and 30% more likely to use alcohol after being through a sexual assault. PTSD is highly prevalent in sexual assault survivors after initially, and then 9 months after, it's extremely high. Specific concerns or risk for harm by and to others. So higher risk of being sexually assaulted again, especially if the environment or relationship hasn't changed. So that was from the World Health Organization, which was kind of an interesting thing that I didn't know before. So if you've been sexually assaulted, you have a higher risk of being assaulted again. And then people that have been sexually victimized are more likely to offend or sexually assault others, which I also thought was interesting. But I know that you sometimes hear stories about pedophiles that were sexually assaulted as children and are now offenders, so that makes sense. And then intense physiological trauma can lead to PTSD, which we covered earlier, and the PTSD can lead to violent outbursts, which could lead to harm to others as well. And then these are my references.